Good morning, everyone. Let's go ahead and get settled. Let's go ahead and get started. So good to see everyone, even despite the rain. As I mentioned, good morning and buenos dias. It's not a Hispanic Heritage Award event without somebody attempting to speak Spanish, so I had to get that out the way. My name is Marvin Figueroa. I'm the Director of the Office of Intergovernmental and External Affairs here at the Department of Health and Human Services, and I want to start off by welcoming you to your department and to the inaugural and hopefully annual 2023 HHS Hispanic Heritage Summit, Avanzando Nuestra Salud. There are three things I want to get out the way before we truly get started. One, don't leave here today with knowing the same number of people as you did when you first started. I want you all to interact, to engage, to meet someone who will be your co-conspirator in the name of equity. Number two, I want to acknowledge those who sacrificed throughout the pandemic. I don't have to tell you all that communities of color know the consequences of unequal social, structural, economic, and environmental conditions that determine people's risk of illness and their access to care. Let's remember those who were frontline workers, because for us, they were not frontline workers. There were our tios, there were our tias. For me, it was my mom, who was a middle school cafeteria lady, woke up every day and sacrificed her life and her well-being to serve and feed others. Number three, let's recommit ourselves to the work ahead. We know that there are challenges, and I want to reiterate something that we all know, that we have to show up, we have to listen, we have to learn, and we have to be tireless. Because as much as we want to change the status quo, there are people who are fighting tooth and nail to keep things as is. Over the course of the day, we are looking forward to engaging with you for time of reflection, celebration, and hope. And I want you to ask yourself a couple of questions. One, where can HHS be a partner in addressing barriers and augmenting ongoing efforts to address them? How do we encourage Latinos to enter and stay in the healthcare and wellness space? And then three, what is your responsibility? Where do you show up? We hope that you will cherish this time with us and you feel inspired. Feel free to take pictures by our photo wall that is located in the East Wing and use the hashtag HHS Hispanic Health Summit and or hashtag Avanzando Nuestra Salud. One thing you can rest assured is that this department is committed to equity, and it remains in the center of everything that we do, and that's because of the leadership of Secretary Javier Becerra. Before I bring him on stage, I want to say a couple of things about the Secretary. I came to learn about him, about Secretary Becerra back in 2010 when I was a Congressional Hispanic Caucus Institute Fellow. He was Congressman Becerra back then, representing California's 31st District. I see some Californians out here, a rowdy bunch. I admired how he consistently prioritized the last seen, the last heard, and the last considered. And his commitment to these communities is seen in every aspect of the department's work, from reducing prescription drug prices, addressing the high rates of diabetes in our community, and leading the most successful vaccination effort in American history. It was under the leadership of Secretary Becerra that we ensured that vaccines were not only at hospitals and clinics, but also las bodegas, centros comunitarios, y las iglesias también. Ensuring that valuable information reached not only medical professionals, but el pastor, la vecina, and other trusted members of the community. His perspective is not only informed by sound research, but also lived experiences. Born in Sacramento, Secretary Becerra is the son of working-class parents. He was the first in his family to receive a bachelor's degree, but also an advanced degree. His mother was born in Jalisco, Mexico, and immigrated to the United States after marrying his father, a day laborer turned construction worker. Without further delay, the 25th Secretary of the Department of Health and Human Services and the first Latino to hold the office in this history of the United States, Secretary Javier Becerra.
Thank you. Thank you. Okay. Appreciate it. You're cutting into my time. Thank you very much. Great to see you. Well, thanks for making it on what otherwise is a pretty dreary day. I want to thank you for being part of this summit, for all the work that you've done, for caring enough to work with us to make sure we're getting to all those people who didn't get to come, and for making a difference, especialmente durante este mes de nuestra herencia latina. So happy Hispanic Heritage Month to each and every one of you. I'm hoping that in about 4 days is still a happy Hispanic Heritage Month because the government won't shut down and we can continue to deliver the services that so many Americans depend on. So right now, I think all I can ask you to do is keep your fingers crossed, but quite honestly, what we can do is ask Congress to do its job and the House to quit playing political games and keep America moving. And so let's do our part of keeping America moving today. To Marvin Figueroa and to his team, and to Tanya Calle especially, who helped set this up, I want to say thank you so much for bringing all of us together. You know, I hope that this is something that happens every year, that you all know that there is a place for you. There's a home here for you to come and, of course, have a good time, but get more work done. And my dad used to always say to me, si me puedo levantar en la mañana e ir a trabajar, va a ser un buen día. If I just get up in the morning, go to work, it's going to be a good day. I think for many of us, we see the privilege we have to not make it a good day simply because it means we've earned enough money to go to the store to buy the food to put on the table. But because we know we're making a difference so that someone else can actually go to work, get paid, and put food on the table. And so we need to do this. And I hope that this summit outlives me and you, and that the next generations of soldiers and advocates on behalf of people who just want to have an opportunity continue to come at a summit like this. Interestingly, so much of what I try to do came from yesterday. You know, I always tell people, if you want to know where a leader is going to take you, know where the leaders come from. And pretty much everything I do, when I talk to everybody about how we're trying to convert healthcare from a system that treats illness to one that promotes wellness, I'm simply saying what my mom used to say to me, mejor prevenir que remediar, right? When we say we want to have everyone understand that food is medicine, we're simply saying we want people to understand that the things that grow in our backyard are probably the healthiest things for us. And I find that the more I go to where you are, or the more we go to where those families are, instead of waiting for them or for you to come to us, the more success we'll have. And that's perhaps why when I became secretary in March of 2021, and I started getting the reports from my team daily, because in those days things were pretty bad with COVID, daily reports on where we stood, the number of hospitalizations, the number of deaths, the number of infections, and the number of vaccinations. April, May of 2021, the vaccine was out. By then, for several months. And we were already starting to get data. And the data was showing that about 2/3 of white American adults had received their first vaccination. But less than 50% of Black and Latino adults had received their first vaccination. It's the same story, right? It's always the same thing we see all the time. But you can break that cycle. And we broke it by saying, we're not going to wait for those families to come to us. because some of them were working 2 jobs. Some of them had to go home and take care of kids. Some of them never have a chance to breathe. We're not going to wait for them to come find us to get the vaccine. We're going to go to them. And so that's what we did. For the next several months, we went to them. We went not just to the clinics, but we went to the churches. We didn't go just to the churches. We went to the schools. We went to the after-school programs. We went to the barber shops. We went everywhere. By January of 2022, 90% of white American adults had received at least 1 vaccination. 90% of Latino adults had received at least 1 vaccination. 90% of black adults had received at least 1 vaccination. Every community had received, 90% of every community had by then received at least 1 vaccination. By the way, vaccines out again. I got mine last week. Are you getting ready to go hug and kiss your grandma for the holidays? You need to get vaccinated. So please don't forget. I'm going to see my 90-year-old mom in a couple of weeks to celebrate. Actually, she'd kill me. She's 89. In 2 weeks, she turns 90, and we're going to go celebrate. I am not going to infect my mother, who's not had COVID yet, because she's done everything the right way. And so I got my shot already. I hope you're doing the same thing. So Thanksgiving and the holidays in December for Christmas and the rest will be happy ones for all of you, including those who aren't as healthy as you, who are more immunocompromised than you, and could use your love and protection. So please get vaccinated. It's out there. Not a single American should have to pay a dime out of pocket for that vaccine again. And so we're making that available. So, Mes de Nuestra Herencia Latina, important time. We're making a difference. Importantly, I know you. In many ways, you know me, because we're trying to achieve much of the same. And we're probably doing it, in many respects, the same way together, or the way our parents taught us to do it, right? When I see a family, I have 2 automatic reactions. Do I know them? If I do, I got to give them a hug, right? If I don't, I want to get them to know them, so the next time I see them, I can give them a hug. And so I hope that we take that attitude in everything we do. You're going to become my family, one way or the other, because we learned not one of us is safe with a COVID infection until all of us are safe. And so we got to do the same thing in everything we do. So we're going to go around the country and try to make a difference. And I hope you're here to try to help us make that difference even better and even faster, because you're doing work, we're doing work, doing it together. We're far more than the sum of our parts. And so that's why we're here at this summit. I hope you're prepared to do those things with us. Let me close by saying one last thing. We would have seen the disparities in that first year of the vaccinations had not we broken the mold in the way things were done. We would have seen more families die had we not approached them in more than just English. We would have seen fewer Americans have the capacity to get their own care because they had their own insurance had we not reached out to them. And today I can tell you that there are more Americans that have health insurance, their own health insurance, private or public, than ever in the history of the country, more than 300 million Americans today, because President Biden made a commitment to reach out and make sure more and more Americans were covered. And by the way, the reason we succeeded so, the Affordable Care Act, Obamacare, today there are more Americans who are insured because of Obamacare than ever before. When the president took office, about less than 11.5 million Americans had health insurance coverage through the marketplaces on ACA, on Obamacare coverage. Today, that's about 16.5 million. We essentially, in less than 2 years, we were able to go 50% above what the previous administration had when it came to reaching out to people. The importance of that is this. It wasn't just that we increased the number of people on Obamacare. It's that 53% of Latinos, 53% more Latinos signed up for Obamacare in the last year than before, and 50% more blacks signed up for Obamacare than the year before. That's why we broke records, because we went out and went to where they were, because they didn't want to be uninsured. They didn't want to live without having a chance to send their child to the doctor or the hospital when necessary and then pay the big bill afterwards. No, everybody wants to have insurance. They just weren't sure how to connect. So that's why when we went to them, it's no surprise that Black and Latino families, they signed up in record numbers. That's what you can do when you do it together and you got a leader at the top who says we're going to get it done. I hope that you want to be part of that leadership that helps us get it done, because we're going to go to where people are. We're not going to do things mildly. I always tell my team, never do mild. When you're given a chance to do something and be in that leadership spot, pagas el precio si no haces algo. Never do mild. And so I ask each and every one of you, as we conclude the summit at the end of this day, to recommit to do more, double down. Please don't do it mildly. There are lots of families out there who are waiting to get insured, who are waiting to get vaccinated, who are waiting to have someone who will help them treat their mental health challenges, who are asking you, do not do it mild. And as we reach out, remember, we're doing this because they are family. Thank you very much. Look forward to working with you.
Thank you, Secretary, for those inspiring words. We will now transition to a fireside chat led by HHS Deputy Chief. I just promoted you. Deputy Chief of Staff, Angela Ramirez.
By the way, she comes from my hometown of Sacramento, California.
I do. Good to see everyone. Happy Hispanic Heritage Month. We're going to kick this off with it's going to get a little personal, so I hope you're ready. I hear you're a fan of Star Trek, and I think I'm doing this right. So with that in mind, could you tell us what you think the greatest challenges the Latino Hispanic partners here today are going to face when advancing health equity to help Latinos, and here we go, live long and prosper?
Yeah. Well, we could talk about the things that are impacting our lives, that whether through nature, genetics, or access are making it tough for our families. The fact that diabetes is a scourge for too many Latino families, as it is for other communities. But I will tell you that the things that we have the capacity and the tools to overcome pretty quickly, I just mentioned, and that is, don't let a family that doesn't know that they qualify for Medicaid not apply. Don't let a senior who worked and paid for Medicare not understand that they can get Medicare and get it subsidized under a program that the federal government has for those who are on Medicare. Don't let families believe that because of their status they can't get vaccinated. And so it's just going to them. And that's something we can overcome, is not letting people's busy life with those two jobs or caring for those kids or trying to make sure that the parents or the tios and tias who live at home get cared for. Don't let that be the reason why they don't find out that they can connect with healthcare the way they need it. And so that's perhaps the greatest challenge, but the greatest thing about it is that's a frontier that we can conquer.
I'm impressed you worked in the word frontier. Yes, well done.
I had to.
I know you've said, Mr. Secretary, that mental health is health. I hear that a lot around these halls. How does the launch of encuentraapoyo.gov aim to reduce disparities in mental health treatment and substance use services in our community?
So encuentraapoyo.gov is our way of saying, if you're not connected, and we're not there to connect you, then just go to, if you can get on the internet, you can go to that website. In English, it's findsupport.gov. But we want to make sure that you don't have to worry. Si no habla bien el español la persona, no tiene que tratar de encontrar findsupport.gov. Mejor en el idioma. And so we're doing everything we can to make it a lot easier. So translation, interpretation has become a big deal for HHS. And so much of what we do, we're trying to make sure that we're making ourselves accessible so it's easy to come to us if we're not there to go to you.
It's incredible just to think about the number of people that are going to be impacted by that. I'm going to turn to the women's rights to choose. Could you talk a little bit about the steps HHS is taking to protect women's rights to choose so that we can have access to life-saving medications, protect doctors, those who are putting their needs above everyone else?
And I see Dr. Elena Rios, who's here from the National Hispanic Medical Association, who's has been not just a great champion on this front, but someone, Elena, I won't go back and say how long we've known each other, but we've known each other from our days at Stanford University. But the issue of women's health care, reproductive health care, is certainly important for all of us. Whether you're a female or not, it should be important to all of us because it's health care. Just like I worry about care for elderly. Actually, I'm getting pretty close there too, so I should worry about that.
No.
But I worry about health care for children, and my kids are all in their 20s, right? So we should care about it first and foremost. But obviously, if you're a woman, you better care about it because it impacts you personally. But if you're Latina, this really impacts you because the communities that are going to be most impacted by the Dobbs decision are mostly women of color, women of lower means. Because at the end of the day, the laws, as crazy as they are now on reproductive choice, make it so that if you got enough money, you can eventually find the care you need if you need abortion care services. But if you don't have the money, you work the 2 jobs and you have the family at home, there's a good chance that you're in trouble. And so we are doing everything we can, first and foremost, to make sure everyone knows what their rights are when it comes to health care, including reproductive care, health care, and including abortion care, contraception. Once you know your rights, we want to make sure that if you feel that your rights have been violated, we want to make sure our Office of Civil Rights is there to enforce your protections. And we've taken actions already against some providers, some states, for not protecting women's rights. Secondly, we're doing everything we can to facilitate access to the care. You've probably heard that the Department of Defense is making sure that women who are in the military continue to have access to the care that they need, even if they may be located on a base that's in a state that no longer offers that woman the reproductive health care she needs. Every step of the way, President Biden has told us, every Department of Health and Human Services, Department of Defense, Department of Veterans Affairs, you name it, we're doing everything that we can within our jurisdiction to make sure that no one in America goes without access to the care that they need, and that means women and for reproductive health care. And so we're going to continue fighting. We want to make sure that contraceptive care, mifepristone, the medication that's been used not just successfully but safely for more than 20 years, continues to be available for women when it comes to contraception. And we don't want to overturn the process that we've used for decades now to not only make available mifepristone, but so many other medications that the FDA has to certify are safe and effective. If one judge in one court in one state can overturn medication that's helping and has helped millions of Americans over the course of time, then what can happen to the medication that's for diabetes or for heart disease or for cancer? If one judge can say, no, it wasn't processed the right way. And so we're going to go out there and we're going to protect that woman's right to mifepristone because it implicates not just her right, but the right of every American to get the other medications that the FDA has certified are safe and effective and should be available to all Americans.
It's definitely worth an applause. I know we have a full summit ahead, and so I want to do our best to keep us on time. So I think I will close with this question. We're going on 3 years now, and a lot has been accomplished. But could you tell us, in these going on 3 years, what you are most proud of in this position?
I mentioned one, making sure my 89-year-old mother has been safe from COVID, which means that what we put out there works, which means your 89 or whatever age, your old grandparent, parent, loved one can also be safe, just like the 9-year-old and the 9-month-old can, if we do things the right way. And I guess that's to say for me, what makes me proud is knowing that we are truly at HHS impacting the lives of people like my parents. And for me to have this opportunity is my dad passed a few years ago. My mom is still with us, as I said. Everything I do, I sort of put it through the lens of, is this helping someone like my mom and my dad? Because my dad had to leave school after the 6th grade because he was the oldest of 8, so he had to start working. He did physical work all his life. My mom didn't come here till she married my dad and came from Guadalajara, Jalisco, Mexico, and learned English very quickly so she could go to work as well. And she became the entrepreneur and bought a little house here, little house there, and before you knew it, they were making as much, if not more money through her investments than through their both work. And I figure if they found a way, that my mom says they came with $13 in their pocket from Mexico when they married, they could figure out some way to make it work for 4 kids, to get them all school and college or the military, and then see grandkids who are going to some of the best universities in the world. I want everyone to be able to experience what my parents experienced. And I got to tell you that when I see the number of Americans who are enrolled for health insurance go to record levels, when I see us erase the disparities in people being vaccinated, when I see a summit where I see people that look just like me and I know attending because they want to do the same thing, I'm helping people just like my mom and dad. And so nothing better than that. Thank you.
Nothing better than that. Well, Mr. Secretary, we are I'll speak on behalf of the room. We are very proud of you and really appreciative of your leadership. I will close us out by, again, wishing everyone a happy Hispanic Heritage Month, and I hope today's summit is a productive one.
Thank you.
All right, thank you all. True to form, I'm going to try to enforce my get to know someone new. I want you to turn to your left or your right, whoever you know the least, and introduce yourself. Go. All right, all right. All right, we're going to bring it back. But that was good. That was good. That was good. That's just the beginning, y'all. That's just the beginning. All right, we're going to get started with our first panel. And the first panel is titled, "The Bridges We Built, Expanding Access for Hispanic and Latino Communities." We welcome to the stage Arsenio Mataca, Counselor to the Secretary, who will lead this discussion. He is joined by an incredible number of panelists. First is Dr. Mina Seshmani, Director of Center for Medicare; Edward Garza, Executive Director, Mexican American Council; Aisha Young, Virginia Engagement Manager for the Young Invincibles. And the purpose of this panel is to highlight major advancements in healthcare and coverage among Hispanic and Latino communities, outline administration actions to address these issues, and share resources that are available to everyone. Happy panel.
Bienvenidos a todos. Welcome, everyone here in the audience and streaming live to the first ever Hispanic Health Summit here at the Department of Health and Human Services. Let's give that a round of applause. It's been too long, but we're here today. Before we get started, I wanted to remind folks that you can submit questions throughout the panel by writing them down on these posted sheets of paper somewhere around there. Maybe they're at your desk or your table, and then handing them to somebody. Somebody will come and pick them up if you lift your hand. We already have a question here already. It'll be collected, and then it'll be submitted during the audience Q&A question later on. So this panel is titled "The Bridges We Built: Expanding Access to Hispanic Communities." And during this discussion, we will highlight major advancements in healthcare and coverage among Latino Hispanic communities and outline the administration's actions to address these issues and share resources available to communities. So we have a fantastic panel with us today who each bring their different perspectives when it comes to increasing healthcare access and coverage to Latino communities. I want to first introduce to my left Dr. Mina Seshamani. She's the director of Center for Medicaid here at the HHS. Next, I want to introduce Edward Garza. And Edward is the executive director of the Mexican American Council Incorporated. And finally, I want to introduce Aisha Young. Aisha is the Virginia Engagement Manager at the Young Invincibles. So first, thank you, yeah. So first, I'm going to start with Dr. Seshamani. The first question is, what are some of the key challenges that Hispanic, Latino communities have faced in accessing health coverage, and how has this administration, and really what have they done, what has the administration done to address those challenges?
Thank you, Arsenio. Es un placer estar con ustedes hoy. So I lead the Medicare program, which is for more than 64 million people in this country, people aged 65 and older, people with disabilities, and people with end-stage renal disease. But before I took this job, I was practicing as an ear, nose, and throat doctor. And I think to your first question about some of the key challenges, if you'll humor me for a little story. So I was the only physician in our group who spoke Spanish. This was in California. And I had a woman who came in with her 9-year-old daughter, spoke Spanish. And she said, my daughter for years has had, this really foul smelling like mucus coming out of her nose. And I went to the doctor and they keep telling me it's allergies, and they've put her on all of these like allergy medicines, and it's not working. And now all the kids are making fun of her in school. And, but I know there's something going on. Like, I just know it, but no one is, this is over years. No one, everyone's telling me it's nothing. And so I asked her, I said, any chance that your daughter stuck something up her nose? And she said, well, when she was 5 years old, she put a bean up her nose. But I tried to tell the doctors that, but they're like, oh, no, that was so long ago, that's not relevant. Well, guess what, everyone? So I got my equipment, and I pulled a 4-year-old bean husk out of her nose. And the mom started crying and said, finally, somebody listened to me. And again, I think that is one of the key issues for the Latino community, that it makes a difference when people can speak your language and can engage with you. And that's something that I have carried into this role, leading the Medicare program. So, for example, Medicare Advantage is a program where people in Medicare can get their health care through private health plans. And we recently made changes to the program requiring that in provider directories, they have to list the language capabilities of the providers so that people can search to find a doctor or other clinician that speaks their language. We are requiring multi-language inserts for all, required correspondence and materials for people in Medicare. So that's just 2 examples there on the importance of cultural competency and communication. I think you all know also that the Latino community has a higher risk of chronic conditions. In the Medicare program, among people with Medicare, Latinos are 70% more likely to be diagnosed with diabetes than non-Hispanic whites. And so some of the things that we're doing to try to improve access to care, like the new drug law that the president passed, that Congress passed and the president signed, starting this past January 1st, nobody pays more than $35 for a month's supply of a covered insulin product. That's like 130,000 Latinos who now do not have to pay more than $35 a month for insulin. And again, I had patients who didn't take their insulin because they couldn't afford it. And similarly, thanks to the new drug law, now recommended vaccines are $0 out of pocket for people with Medicare. And among Latino Medicare beneficiaries, they spent more than $7 million in vaccines. So I think $7.9 million in 2021. And that is money that now everyone gets to keep in their pockets and spend on food and their housing and other things that are needed. So really also in terms of improving access to care and the affordability of care. So I will stop, but those are just two examples of what I know are challenges, facing our communities and what we in the administration are trying to do.
Great. I have more questions for you, so that was great. I have a question about the friol, but I'll save it for the green room. Okay, Aisha, from your perspective, you're on the ground as a patient navigator. We hear a lot sometimes from government about some of the initiatives at the top, and they're great, but how are those initiatives that the director highlighted impacting the communities that you serve on the ground?
Well, I don't have a story about a bean up my nose, but I wish I did. But thank you for having me. I want to say that first. But thinking about everything that she just said about the language access, I do a lot of work in Virginia with college students, and I help them understand health insurance. I do the literacy, I do the outreach, and I do direct enrollment. And in my presentations, I do include information on uninsured, but those materials are also translated into Spanish as well, because unfortunately I don't speak Spanish. I wish I did, but it helps me feel confident knowing that even though I can't help them directly, I still have information translated for them so that they can get the help that they need, from somewhere else. I also lean a lot on some of my partners' organizations that do offer Spanish assistance or translated services. I lean on them a lot because, again, I don't speak Spanish, so I want to make sure that when I am out in the field that I can help them. I never really want to turn anyone away, so I want to make sure that I have that information. So I give a lot of thanks to HHS providing those materials for us so that I can use when I do my outreach or when I'm making presentations or when I'm trying to do videos or just sharing with the community. One thing I also want to mention is I do work with a lot of documented students, DACA students, recipients, so I'm hoping that this year that they'll be able to pass that expansion for them so that they can get coverage. And this way, this open enrollment, thank you. This way, this open enrollment, I'll be able to assist them because I know a lot of them will stand to benefit from that. And I just hate turning them away. I'm thankful for those community resources that we have because they're so important, especially like 988. 988 has been very reliable because immigration status doesn't matter. So I'm thankful for that. So I am hoping that that rule is also passed. But I'm grateful for that language access barrier because it really helps me do my work on the ground.
Great, thank you. Thank you. So Eddie here, beyond coverage, the Biden administration has also worked tirelessly alongside partners like yourself to get care to people throughout the pandemic. Can you share more about your experience leading a COVID-19 vaccine campaign for farm workers in Florida? Was it called Vacunate, or I don't know what it was called, but
yeah.
But share us a little bit
Vacunate.
about that.
But before I do want to say, what an honor it is to be here with all of you here at the HHS building. Thank you to Secretary Becerra for your leadership, sir. Thank you to Director Figueroa for putting this together. Tanya, fantastic job. If she's still around, can we just clap it up for this team one more time? Amazing, amazing. So down in South Florida, we launched Vacúnate, por ti, por tu familia, por tu comunidad. And this was an adult-focused COVID-19 first awareness information campaign, and then secondly, creating an entire network built from the bottom up to ensure that regardless of where you were, you had access in a dignified way to the shot. But, you know, so many elements to that. I want to say it was three-pronged, really, more than anything. First, it was, and I see Unidos US in the house. I want to give a big shout out to you, Pedro, for your guidance and support, because the first part was really preparing influential community-based messengers. Folks like Dr. Dadilia Garces, an epidemiologist based with Miami-Dade College Medical Campus. Shout out to MDC. I'm an alumni, I'm a shark, what's up? But getting folks that knew the community, that were from the community, that spoke the language was important, but really more than anything, that had a love and respect for the community, that knew how to approach us in a dignified way, breaking down the barriers, because there was so much fear. I mean, guys, you all remember? Pandemic hits, and we're like going to the grocery store looking like in hazmat suits, washing tomatoes when we came home. It was so much fear. And to say we were fearless is not true. We were very scared, but we had to be brave. We had to be brave for those that really needed to see the bravery come out of us. So first it was doing those, you know, getting our information correct and having those positive community-based messengers. Then it was getting the partners together, folks like Community Health Incorporated, CHI, and Miami-Dade College Medical Campus, the school systems, and so many different partners together. And the last part was that true network built from the bottom up. I spent more days at the flea market in the last few years than I have my entire life, because we knew that you had to go to where the people were. And after church in our communities, everyone's eating at El Tacazo, at the flea market. So if we're right next to them, with Dr. Dadilia Garces in her white coat, speaking the way that we speak, saying it's okay. I saw grown men who work outside every day cry as that needle came into their arm, holding their hands. But it was that bravery that they needed to overcome for themselves, for their families, and for their community. Thank you.
I have some questions, follow-up questions, but maybe we'll have time for that, or the audience may have some questions. That was great. Dr. Sheshimani, with these important lessons in mind, what initiatives and policies should folks in the audience here today keep a pulse on or keep an eye on?
Yeah, so I'll pick up where I left off on the new drug law. As you all may have seen, we announced the first 10 drugs to be selected. So this is historic for the Medicare program, that we are going to be directly negotiating with drug companies on behalf of people with Medicare. And there are some drugs for diabetes on that list, which again is particularly important for the Latino community. And so, you know, stay tuned with that. We are going to host patient-centered listening sessions so that we can hear from people what these drugs have meant for their lives as we begin the negotiation process. And then, you know, two other things, piggybacking off of what Aisha said about, you know, the importance of navigation. We have 2 open enrollments coming up. So Marketplace open enrollment will start on November 1st. And from 2020 to 2022, the number of Latinos enrolled in the healthcare marketplace increased by 53%. More than 900,000 additional people got covered. And that is something that is thanks to many of you, making sure that people know what options are available for them. Medicaid renewals, you all know all that's going on now with the end of the public health emergency. CMS took swift action to prevent 500,000, you know, mostly children, but also others, from being disenrolled inappropriately. So make sure that you are telling your communities they need to update their information with the state Medicaid agencies, respond when a renewal notice comes, and making sure people know where to get help to be able to navigate this. And if they're not eligible for Medicaid anymore, getting help for enrolling in healthcare.gov. And the third area is Medicare. Medicare open enrollment starts October 15th and goes until December 7th. And as any of you who has, an older loved one in your life, there's a lot of bombardment that happens to our nation's seniors around Medicare open enrollment. We have been trying to do a lot. We have put in place new policies to reduce misleading marketing practices so that people can really choose the option that is best for them. And I encourage all of you to let people know about open enrollment, direct them to Medicare.gov or 1-800-Medicare as the true source of information to figure out what, for example, the $35 insulin cap means for them, or are they eligible for extra help for financial assistance for people of lower income. We work on all of these, piggybacking off of something Eddie said, we work on all of these policies, right, in government, and we put out these regulations and we put out these guidances. None of that makes a difference if it doesn't actually reach people on the ground. And it doesn't actually come to life, right? I've talked about $0 vaccine, but if you have an abuela out there who doesn't know that she can go get her, shingles vaccine now and not spend $200 for it, she's not going to go get it, right? And so it's so important that we have trusted messengers in the community reaching out and helping people navigate health, which is very personal and very complex. So really, it's a shout out to all of you for the work that you do, because that's where it really makes a difference. When you are reaching out into the communities and making sure that people are getting the information they need and that they are able to access help and supports that are available.
Great. Well, let me see if we have any questions from the audience. I know there was one. There was a quick hand. Is this it? I expected
They got the hard one for you. Aisha's taking all the hard questions,
No,
just
I'm
so
not.
you guys
Don't
know.
listen to him, please.
Okay, so the first question is to both Aisha and Eddie.
He knew
when
it.
when you talk about stigma and the issue of stigma against the use of public programs like Medicaid and CHIP, they can be a significant barrier to care. So how have you addressed this barrier in your work?
Oh, I gotta go first? Okay. Well, when it comes to public programs, and I know there's a lot of stigma around it because of public charge that kind of did a lot of damage, I realized that being more informed and up to date on that information really helped me to relay the truth to them, because they are more receptive to the truth. When I say them, I'm sorry, more of the Latino communities that I work with. So I try to make sure I stay up to date on that information so that I can relay that information. Again, I don't know if you all heard of Young Invincibles, but we do a lot of work with young people, 18 to 34. Shout out to Young Invincibles. But we engage a lot of young people. And for that reason, young people are really bless you, the trusted messengers in their family, right? A lot of Latino families rely on their kids to give them the information of what's going on. So we try to lean on young people a lot to provide them with the information so that they can let them know what's the truth and what's not, to dispel myths about vaccinations, to ring the alarm on public charge on in unwinding, Medicaid unwinding, like Dr. Mina mentioned. And also, again, I rely a lot on our partners. So I rely on some of my partners to go out in the field with me, especially for older Latinos, because I am a young person, thank you. So they get to be able to, talk to the older Latinos that maybe I can't connect with because, maybe we don't share the same values, or maybe they look at me like, what does young girl know, right? So I like to lean on a lot of my community partners to, connect with them and to give them updated information so that this way they can make the best decision for them. I hope that answered your question.
Eddie, what do you guys say about that?
Yeah, great, Aisha. And this is why we like each other, we get along. We at MAC are really focused on that 18 to 26-year-old as well. We have a very robust scholarship program. And what we all know in this room is that when you're a first-gen person in your family, you are the parent many times. You're making decisions for the whole family. But before we get there, to more directly answer your question, in the heart and the heat of the pandemic, while it was part of the discussion, that was not something that families were taking into account. It was more like, this is life or death, and let's get you this shot, let's get you a mask, let's get you tests to take at home. So what we had to overcome was not that. It was distrust in a system that had used and abused populations of culture and color for many, many years. That was the challenge we had to overcome, building trust in a health system that wasn't trustworthy in the past. And that's why the work that we're doing, that we all did together, must continue, because we actually created networks and built systems that are efficient and effective and that haven't been created in many, many, many years, if not at all. So we must keep the pedal to the metal for that, for building trust in the health system, building that public trust, rebuilding it, and we must maintain it.
Great, great. Thank you both for that. Dr. Mina, there's a question in the audience about if I have a family member who needs extra help to pay for Medicare premiums, are there any resources to help me? I'm sure you know of some.
Yes, absolutely. And the best source of information is to call 1-800-MEDICARE to get directed. But there are two programs. There's the Medicare Savings Program, which is for people of lower resources to help pay premiums, co-pays at the doctor, et cetera. And circling back to one of the themes of what we're talking about how important it is to engage with communities. When I took my role leading the Medicare program, we estimated that only half of seniors who were eligible for this program were actually enrolled. So we made it a mission during our open enrollment to tell everyone about this program so that people could learn about it, figure out if they were eligible, get enrolled. In one open enrollment cycle, we increased the enrollment by about 800,000 people. And we actually have a proposed regulation out now to further streamline, reduce paperwork, make it more automated so that people can enroll very easily in the program. And in parallel, we have a program called Extra Help, which is on the drug side too. Again, to provide support for people with paying for their drugs. And thanks to the new drug law, starting January 1st, 2024, the eligibility for that program is expanding. So very important, if there is anybody that you know who is struggling to pay for costs, to call 1-800-MEDICARE so that they can get information about these programs, because that's why these programs are there.
Great, great. Here's another question. This one's for you, Eddie. How are you navigating equity in healthcare in the wake of some of us live in states where there's an anti-equity sort of movement going on? And so how are you managing that in your work?
Well, I'm in sunny South Florida.
I'm just reading the questions.
We all are facing different challenges at our states and in our communities, and this is, to me, just the latest one, right? SB 1718, for those who are not aware, what's been happening in Florida, has definitely been an incredible challenge. But what we've noticed is that stakeholders that truly care about the community have risen to the challenge. We've created some amazing allies in industries that you would think would be contrarian to our community and what we're doing. But it's because people care about people, and I still believe that. And I've seen really great aspects of humanity come out in reaction to this. And so I would just say that hope matters. Alliances and building communities matter. And we've been able to create alliances and build a community based on hope in the future that we know we're going to see come to fruition. And it's just that. You have to face these challenges head on. We're doing this without shame and just looking at it right in the face and saying, we are a community that has been here for years, and we're going to continue to contribute to the big picture.
Great, great. Dr. Mina, for folks in the audience, how can external partners here continue to work with your office and CMS more broadly to ensure that communities are informed about the ongoing activities by CMS around coverage?
Yeah, so as I mentioned, really being able to get the word out about, for Medicare open enrollment, 1-800-Medicare and Medicare.gov, being able to work, with all of our partners on marketplace open enrollment as well, right? We have the state health insurance programs that help with navigation, the healthcare navigators. Those are all very key ways that we can improve coverage by really taking people by the hand and helping them to navigate and figure out what works best for them. And I would say, taking a step back, at a higher level, it's so important to us with everything that we're doing that we're hearing from all of you. What's working? What's not working? What would you like to see be different that we can incorporate into the work that we do every day? And when we do implement a new program, do open enrollment, put out, new guidelines, oversight for, the industry, that we're partnering with you so that you can continue to be our eyes and ears on the ground, and that you can make sure that people in your communities know what these programs can do to help them and how to get access to it. So really that partnership is what's going to make or break all of the work that we have ahead of us. And
many folks here in the audience are leaders of their own organization. Is there a specific way, if I'm sitting in the audience right now and I lead an organization and I want to have a more direct sort of conversation with CMS or you about that, how does that work? Is there a special, other than the public, responding to public dockets or whatever, is there some special way where the Latino or Hispanic community can connect directly with CMS on those issues, or are there some pathways to that?
Absolutely. So we regularly have, listening sessions. I mentioned, for example, the patient-centered listening sessions. Registration for that is open until October 2nd. On CMS.gov, you can get information. Also, through our, Office of Communications, through the internal, intergovernmental and external affairs at HHS, those are all avenues for being able to interact with us. We do meetings. We have an open door where we want to meet with people to hear from them. We also host quarterly stakeholder calls at CMS that, if you're not on that list, you can get on that list, where once a quarter we walk through what are all the things that we're working on, and it's a great opportunity to get ideas as well about what else we should be working on. So you're right, there are, when we put out a regulation, we invite public comment, but that is definitely not the only avenue for us to have a dialogue. Through these kinds of listening sessions and events, by reaching out to us to set up individual meetings, these are all ways that we want to stay connected.
Great. The next question is for Eddie and Aisha, but really I think could be for anyone. I'm curious to hear, this question is, what work are you doing to help, if any, to help diversify clinical trials? How can we work together on this, is the question. I
don't know if we necessarily did any clinical trials, but I would definitely say we're open to forging any new partnerships if you're trying to engage our community. We have a focus on farm worker families and youth in down south, but definitely have not had any experience in that space just yet.
Okay. Dr. Mina?
We do, on the Medicare side, pay for care that's associated with clinical trials, so that, that can decrease barriers that can otherwise be associated with enrolling in clinical trials. I think this is something that our colleagues in the FDA are definitely working on and looking at. When they are evaluating drugs, I think we all know how important it is to have diversity in clinical trials, because different populations oftentimes respond differently, have different needs. And as I mentioned before about the drug negotiations that we're undertaking, the foundational, aspect in the negotiation is the benefit that these drugs provide to people. And it's very important to us that we are looking at whether these drugs serve an unmet need in communities, and that we look at how they address disparities and different needs among different populations. So that's another avenue through our negotiation process where we are asking for information on how these drugs serve diverse populations.
Great, great. Now's your last chance if you haven't gotten in a question. But I want to now maybe turn to our panelists. I have several, as a moderator, I'm supposed to just moderate the conversation, but I am interested, I'll take a liberty here and ask you, Eddie, when I was in California, I used to be a legal aid attorney where I'd go out to the fields from a legal perspective and, advocate for farm worker rights, making sure that the labor contractor or the farmer is following certain laws, right? And we would do field inspections. But can you talk to me about your relationship with the employers of farm workers as you went through that campaign? Because at least from my experience in California, I saw some rather unique and sort of breakthrough relationships built that I didn't think were possible. So I'm wondering for your experience in Florida.
I am so glad you brought that up, because that's exactly what happened in Florida. We had different industries, their representations, their associations. I will say one of them, and I'm going to give a really big shout out to the Dade County Farm Bureau. They represent all the major farmers in South Florida. And they were my #1 ally in giving me access and additional resources to our farm labor community. And I didn't have to fight farmers. I didn't have to sneak around. I didn't have to work around to get to these giant nurseries. No, they wanted to ensure that the population was safe. And those are partnerships that we've continued today. And when SB 1718 hit, who was right next to me talking to our community? The executive director of the Dade County Farm Bureau, right next to the executive director of Community Health Incorporated, right next to our head of police from Miami-Dade County. So I had the major stakeholders at town halls across South Dade telling our community, do not be in fear. But that only happened because we had built those relationships over the pandemic. And they saw the human side of what we do. And again, we gotta keep these systems going. We have to keep these alliances and partnerships going. They're way too important to let them stop right now.
Great. I think that's a perfect example of the bridges that we've built and the title of this panel. I'm just going to lastly turn it to our panelists for closing thoughts. If you have some closing thoughts, let's go with Dr. Let's go with Aisha. Let's go reverse. Dr. Mina says, let's go to Aisha over there.
I didn't sign up for that.
Aisha, what are your closing thoughts? What should folks? What do you want folks to know about?
Well, I'm gonna speak personally. Just being up here just really makes me realize the work that I do is truly important, and I am happy to be on the ground and assisting people. I also want to say what Dr. Mina said. Open enrollment is coming. It is November 1st through January 15th, but if you want coverage, please sign up by December 15th to have coverage by January 1st. It's kind of confusing. I still get confused. I've been doing this for 5 years, but I just want to let everyone know that if you are on the ground, your work is important, and we do need you, especially young people. We need those voices. Even though we don't do clinical trials, we do listening sessions, we do focus groups, and we want to hear from you because we have to hear from you in order to know what needs to be changed and to help us push our work forward. So please, please, please share your stories. Be a storyteller. Share your own story if you can, because it does help others to see people that look like them and to understand what you're going through. And this way they can make informed decisions based on knowing that they're not alone, right? So I'll leave you all with that.
Great.
Oh, also, I'm sorry, 988, please. If you do, if you are going through a mental health crisis, 988 has been a great, reliable resources, and I encourage you to reach out if you do need help.
Great. Eddie.
First it's gratitude, right? I want to thank HHS. I want to thank Unidos US. I want to thank Community Health Incorporated and the folks like Dr. Dadilia Garces and all those business owners and farmers that gave us access to their sites to make this such an effective vaccination campaign. So first, it's thank you, and thank you to all of you. But the second thing that I want to leave you with is don't count out communities of working poor, and set the bar high, and they will meet it. And this is the example. The JJ, the Johnson & Johnson shot, right, was what they were offering at first. And I went to my partners and said, no, I'd like for my community to have an option. And very smart people in very nice suits told me, but they won't come back for shot number 2. I said, what do you mean? How can you make this assumption? Oh, but Eddie, communities like yours, they're not, that's why we're giving you JJ. They're not going to come for number 2. And I fought that really hard. And I want to say that less than 10% of the folks that got the Moderna or any shot that was 2 didn't come back for 2. So over 90% of our working poor community that had to have that personal responsibility to come back for shot number 2 came back. So when you treat communities with dignity and respect, they will answer the call. They will rise to the top.
Dr. Mina.
I mean, after all, this has been such an honor to be here with my colleagues on stage and with all of you. I just echo what both of them have said, and I hope that this energizes all of you. We've done a lot of great work together, and we have a lot of work ahead of us. And we need each other, and we have to do it together. So I'm really thrilled that you all are here today to talk about these issues, and I feel honored that I had the opportunity to join you for part of it.
Great. Well, let's give it up. Let's give it up for our panel here. Thank you so much. You're the opening panel for the first Hispanic Health Summit, so you have that notoriety. I'm going to announce that I guess we're moving to a coffee break, and I'm going to turn it back over to Marvin to take over for us. But thank you all for participating, and thank you all. Bye.
Thank you, Arsenio. Arsenio stole my thunder. It is a coffee break is next. There's a couple of things before we transition to the coffee break that I want to highlight. A couple of things that I heard is that hope matters. Never count out the working poor. 1-800-Medicare. Open enrollment is coming. And that don't forget about the partnership that you've established during the pandemic, and go back and re-energize those friendships. We are going to have a coffee break. We're expecting you back at 11:10. There's coffee, and there's also, I call them semintas in Honduras. They call them conchas, they call them pan dulce, but please finish them, or else I'll have to eat them all. If you go straight right, there's a picture wall there for you all to take pictures, but back here at 11:10. Break.
Produced by the U.S. Department of Health and Human Services.